Yes, YouTube. Yes, you can.
Namaste. Welcome all. Good evening. I am Dr. Swati, counselor. Here is my colleagues, Mrs. Rameshwari and Mrs. Jyoti, counselors, team Manojagrithi. As we all know, on 23rd June, grandly inaugurated our free webinar series on psychological disorders. Since today, our team has discussed about various topics like generalized anxiety disorder and postpartum and premenstrual disorders, childhood disorders, and yesterday we went through the all phobias. Today we are going through schizophrenia. Before going to today's topic, let me brief about Manojagrithi. Manojagrithi is a non-profit organization established with a vision to spread mental health awareness and prevention of mental health issues. Since 2 decades, Manojagrithi conducting several programs in various branches of it. Under the guidance of Dr. Geetha Challa, founder of Manojagrithi, and Mrs. Vijayalakshmi ma'am, mentor, coordinator of the course, we have completed diploma in basic counseling skills. Before jumping into the topic, I would like to settle down all our senses and relax through mindful breathing and grounding techniques. Breathing, it is a gateway to our autonomous nervous system. Breathing is a natural, rhythmical process of moving air in and out of the lungs to facilitate gas exchange with the internal environment. Let's sit comfortably. Remove all your tight accessories. Sit straight. Keep your backbone and neck in the same line. Place your both hands on your knees. Close your eyes gently. Make sure your feet should touch to the ground. Relax all your facial muscles. Drop your jaw. Drop your shoulders. Relax all your body muscles. Relax. 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 Now, bring your awareness to your breath. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Notice the sensation of the air entering your nostrils, filling your lungs, and gently leaving your body. Don't try to change your breath in any way. Just observe it as it is. Gently notice the rise and fall your chest, belly as you breathe in and out. Thoughts may come and go like a passing cloud. Don't run behind the thoughts. Gently guide your attention back to your breath. Inhale. Exhale. Inhale. Exhale. Just observe the breathing. Relax. 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 Now, slowly inhale through your nose, feeling your belly expand with air. Slowly exhale through your mouth, feeling your belly contract. Inhale, exhale, inhale, exhale. Thank you. Let us to do butterfly hug breathing technique. Butterfly hug is a self-soothing technique used to help manage stress, anxiety, and overwhelming emotions. It involves crossing your arms over your chest, placing your hands on your upper arms, and gently alternating tapping on your arms while taking slow and deep breaths. Thank you. Keep your eyes closed. Cross your arms over your chest, placing your hands on your upper arms as if giving yourself a gentle hug. Take a deep breath through your nose while tapping your arms. 1, 2, 3, 5. Just like a butterfly wings. Exhale deeply through your mouth while tapping your arms. 1, 2, 3, 4, 5. Like a butterfly wings. Let us do repeat 2 more times. Inhale deeply while tapping your arms, just like butterfly. 1, 2, 3, 4, 5. Exhale deeply while tapping your arms. 1, 2, 3, 4, 5. Again, inhale deeply. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5. Relax, 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 relax. Whenever you feel to remove your arms around your shoulders, you just remove and place it in your lap. Kindly keep your eyes closed. As we all know, we are connected with our body through 5 senses. Because of our lifestyle, there is overconsumption of our senses. So we need to get them to be grounded. Now, let us to tap into our 5 senses. We will go each one at a time. You can keep close your eyes and do this mindful activity. We will begin with the sense of hearing. Now, listen 5 different sounds around you, non-judgmentally. Just observe them. It might be the sound of the fan. It might be the horn from the outside. It might be the sound from the window. Just observe the sounds without judging them. Now, let's move to the sense of touch, that is, the feel of skin. Now, touch four different surfaces with your right hand or dominant hand and feel the four different textures. It might be the arm of your chair, palm of your other hand, texture of your hair, surface of your table. Just observe them. Don't be judgmentally. Continue to keep your eyes closed. Now, let us to gently tap into the sense of smell. Observe three different smells around you. Smell the object which is near to you. Sense the natural fragrance of your room. Your hair or your attire. Be non-judgmental, just observe. Now, let us to gently tap into the sense of vision. Rub your both hands, make them to be warm, place them on your eyes. Feel the warmth and gently open your eyes. Now, see any two things around you. Observe the texture, color, size, and shape of the things. Be non-judgmental. Just observe them as they are. Now, gently tap into the sense of taste. Take the coffee toffee into your palm. Observe the wrapper, the shape, the size, tapping if they have without judging it. Now, open the wrapper, listen the sound of the wrapper, smell the toffee. Now, put the toffee into your mouth. Bite it slowly. Feel the taste. Feel the saliva which comes from the taste of the toffee. And turn it all your mouth with the help of the tongue. Be non-judgmentally. Feel the toffee, how it is passing through the gut. Hope this rhythmic stimulation might help you all to calm the nervous system and promotes the sense of relaxation. A warm welcome back to the session all. Before starting about the discussion on schizophrenia, let me discuss on psychosis. Psychosis, a mental disorder which is characterized by a disconnection from reality. Psychosis may occur as a result of psychotic illness such as schizophrenia. In other instance, it might be caused by a health condition like a medical medicines or any other drug use. In this one, possibly we can see the symptoms like hallucination, delusions, disorganized thinking, illusions, and all. All these terms, hallucination, delusion, illusion, all these are actually medical terms which we use to describe about the condition of the individual. But nowadays, each and every person, they can going through the different sources and they are feeling that they are having all these conditions. So let me brief about these things first. Delusions. Delusions are false and fixed beliefs that are not based in reality. And when it is, if an individual, when they are sharing about their delusions and all with other people, like the believing that someone is watching by a secret organization, or believing that one's thoughts, their thoughts are being controlled or implanted by an external forces. Let us to go with the hallucinations. Hallucinations are sensory experiences that occur in the absence of external stimuli. For example, like hearing the noises when actually there is no noise, smelling a fragrance that no one else can detect, and someone can feel that the insects are crawling on their skin when actually there are none. Let us to go with the illusions. Illusions are misinterpretations of real sensory information. Example like mistaking a coiled rope for a snake in a dim light, or hearing the rustling of leaves and thinking that if someone is walking nearby, or a moon which is appearing larger on the horizon than it is overhead. According to the DSM-5, the psychotic disorders are characterized by into the schizophrenia, schizoaffective disorders, schizophreniform disorder, brief psychotic disorder, delusional disorders, substance and medication-induced psychotic disorders. Today we are going to discussing about in detail about the schizophrenia. Now I will invite Rameshwari Garu to go ahead.
Thank you, Swati ma'am. Good evening, one and all present here. I'm Rameshwari. Thank you here for being here today. I believe will be both informative and engaging. Let's get started. When you see the word schizophrenia, what is the one word comes to your mind? You can use the chat box. Okay. Let us go through the definition. Okay, few of the participants are aware of it and few are not aware. Ma'am, next slide. Okay, let us see the definition. Schizophrenia is a psychotic condition characterized by disturbance in thinking, emotions, volitions, and faculties in the presence of clear consciousness, which usually leads to social withdrawal. Schizophrenia is often characterized by psychosis, which is a loss of contact of reality. It is a chronic brain disorder that affects a person's ability to think, feel, and behave clearly. In 1911, a Swiss psychiatrist coined the term schizophrenia. Schizo means split and phrenia means mind. But it doesn't mean that it's a split personality. Split personality is again a different disorder. He explained that split occur between cognitive and emotional aspect of the personality. Ma'am, next slide. Yeah, let us see the prevalence. In schizophrenia, the most common of all psychiatric disorders and is prevalent in all cultures across the world. About 15 of new admissions in mental hospitals are schizophrenic patients. It has been estimated that patients diagnosed as having schizophrenia occupy 50% of all mental hospital beds and rehabilitation centers. In every community, 3 to 4% from 1,000 suffer from schizophrenia. In general population, about 1% stands the risk of developing this disease in their lifetime. In men and women, schizophrenia is equally prevalent. The peak ages of onset are 15 to 25 years for men and 25 to 35 years for women. In the age group of 15 to 30 years, about two-thirds of cases are there in schizophrenia. The disease is more common in lower socioeconomic groups. Here are few myths and facts. The first myth is people with schizophrenia have a split personality. But the fact is, schizophrenia is a chronic mental health disorder that affects thinking, feelings, and behavior. Schizophrenia is caused by poor parenting or upbringing. But the fact is, exact cause is unknown, but it's believed to involve genetic, environmental, and neurochemical factors. The third myth is individuals with schizophrenia are violent or dangerous. The fact is, most people with schizophrenia are not violent and are more likely to be victims of crime. The fourth myth is schizophrenia is a result of demonic possession or supernatural forces. The fact is, schizophrenia is a treatable condition, and with the right support, individuals can lead fulfilling lives. The fifth myth is people with schizophrenia are intellectually disabled. The fact is, people with schizophrenia can have average to above average intelligence. Okay. Schizophrenia can affect to not only to adults, it can also affect in children. Let us see the onset before the age of 13 is considered the childhood onset schizophrenia. The preoccupied mind with fantasy, withdrawn, and a typical mind. It also includes hallucinations, delusions, and disorganized thinking and behavior. Even children may experience difficulties with thinking, learning, and problem solving. There may be social isolation and difficulties forming and maintaining a relationship are common in children with schizophrenia. Early onset schizophrenia can be mistaken for other common conditions like autism spectrum disorder or developmental delays. Yeah. Next, over to Jyoti ma'am.
Thank you, Rameshwari. Now, Let us look into the symptoms of schizophrenia. Schizophrenia symptoms are broadly divided into positive, negative, and cognitive. Here, the words positive and negative does not mean they are good or bad, but they are just simply medical terms to coin the symptoms. Where positive means added experiences or added features to the person's life. Like, think of it as extra added experiences which are not usually present in normal individual. Those are hallucinations, delusions, disorganized speech, and thoughts. Let us look into them detailedly. Next slide. Positive symptoms. As Swati ma'am discussed, delusions. Delusions are false fixed beliefs that are not based on reality. We have different types of delusions here, namely persecutory delusions. Here, people believe that someone is plotting against them or trying to harm them. For example, a person might think his or her neighbor has installed a CC camera in his home to spy on them. It is not true, but they think and they believe that. That is persecutory delusion. Next, grandiose delusion. Thinking that they have special powers, wealth, or fame. For example, a person might think that he or she is on a secret mission assigned by the god and they can control the weather with the thoughts. It is not true, but they believe that they are on the secret mission. Jealous delusions. Believing that their partner is unfaithful without evidence. So, their partner might not be cheating, but they believe and they get convinced that they're cheating and they, without any evidence, they believe that their partner is unfaithful to them. Next, somatic delusions. Thinking that they have physical illness or defect that is not real. For example, they might feel something is always crawling on their skin or on their body, despite medical tests proving wrong. Next, erotomatic delusions. Believing someone famous or powerful is in love with them. For example, a person might think that a famous film actor or a movie actor is in love with them and they are sending secret messages through TV shows. So these are some kind of delusions. Now we'll look into hallucinations. So someone asked in the chat box what is the difference between delusion and hallucination. As Swati ma'am told, delusions are false fixed beliefs. They are cognitive, mind based. While hallucinations are perceptory, sensory experiences that occur without any external stimuli. Now we see different types of hallucinations here, namely auditory hallucinations, hearing voices, sounds, or music that are not there. Visual hallucinations, seeing things that are not real, such as objects, people, patterns. Tactile hallucinations, feeling sensation on the skin that are not real, like touching or being touched or being poked. Olfactory hallucinations, smelling odors that are not present. Gustatory hallucinations, tasting flavors that are not real. So these are some kind of hallucinations. In the positive symptoms, we also see disorganized speech and thinking and catatonia, where a person might effectively cannot communicate. Effective communication can be impaired, and answer to the questions may be partial or completely related. For example, their talking pattern is not logical. They might say something and jump into saying something else. Like, I like hot sun, I'm hungry, I want to sleep. or there is a rat in the sky, something like that. Catatonia. Here, purposeless hyper or hypokinetics is seen. Like a person might slowly, deliberately move their hand or place their hand in a position for some time, or they might be frozen for some time and sit in a position for long hours, or some might perform excessive bodily movements. That is catatonia. Now, negative symptoms. Negative does not mean it is bad. It means something has been taken away or reduced in the person's experience, like flat effect, reduced emotional reactivity, lack of facial expression. For example, when you discuss something with them which is very emotional, they might not show any facial expressions. There is zero facial expressions, and their tone of voice is also very numb. That is flat. Allogia, limited speech output, often reflecting reduced thought and poor content. Like if we talk to them or ask questions to them, they briefly give answers or empty replies like, okay, yes, no. They cannot process a full sentence through their thought process. That is a logic. Now, coming to evolution, lack of motivation to initiate, or sustain purposeful activities. For example, they cannot perform their daily tasks like personal hygiene or going to your work or any simple task for that matter. That is evolution. They lack interest in doing such things. Nextly, anhedonia, inability to feel pleasure in normal enjoyable activities. They might like spending time with family and friends initially, but as symptoms we see, they're unable to spend time with their family or friends or like music anymore now. That is anhedonia. Coming to asociality, lack of interest in social interactions or forming relationships. They're fully withdrawn from social interactions and they don't have any interest in forming relationships. That is asociality. Next one. Now, coming to cognitive symptoms, we see poor problem solving skills, attention deficiency, impaired verbal ability, memory deficit, difficulty in concentration. These all come under cognitive symptoms of schizophrenia. Next one. Now that we have seen symptoms, let us see what are the causes of schizophrenia. The causes of schizophrenia are unknown. Research suggests that a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop the condition. Firstly, genetics. The disorder is more common among people born of consanguineous marriages, that is, blood related marriages, close kin marriages. Let us see the prevalence among the family. Children with one schizophrenic parent, 12%. Children with both schizophrenic parents, 40%. Sibling of schizophrenic individual, 11%. Second degree relatives, 8%. Dizygotic twins, 12%. Monozygotic twins, 47%. Now, biochemical factors. Imbalance in the brain chemicals, that is neurotransmitters, especially dopamine, glutamate, and serotonin. Psychological factors. Dysfunctional family system, hostility between parents can lead to schizophrenic conditions. Double-blind communication. It is proposed by Bateson and colleagues in 1956, where he says that parents who convey two or more conflicting and incompatible messages at the same time can trigger schizophrenia conditions. Next one. Social factors. Studies have shown that schizophrenia is more prevalent in areas of high social mobility groups and social disorganization, especially among members of low socioeconomic classes. Stressful life events can also precipitate the disorder in predisposed individuals. I would like to invite Rameshwari ma'am to discuss DSM criteria for schizophrenia.
Yes, thank you, Swati ma'am. Sorry, Jyoti ma'am. Let us see the criteria according to DSM-5. DSM-5 is a diagnostic and statistical manual of mental disorders. DSM-5 is a manual published by the American Psychiatric Association that provides standardized criteria for the diagnosis of mental disorders. It is widely used by clinicians, psychologists, psychiatrists, researchers, and mental health professionals across the world. In criteria A, we see the 5 delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. In this, 2 or more of the following should be present, or at least one of these should include from 1 to 3. In criteria B, one or more major area functioning such as work, interp are markedly below the level achieved prior to the onset. In criteria C, continuous signs of the disturbances persist for at least 6 months. In D, schizoaffective disorder and depressive and bipolar disorder with psychotic features have been ruled out. In criteria E, substance or general medical condition exclusion. And in F, if there is a history of autism spectrum disorder or other communication disorder of childhood onset, the additional diagnosis of schizophrenia is made by only prominent delusions or hallucinations are also present for at least 1 month or less if successfully treated. Diagnostic evaluation. It is done through history collection, mental status examination, CT scan, and MRI. And mental status examination is a structured assessment used to evaluate a person's psychological state similar to the physical exam but for mental functions. In this, the purpose of mental state examination is to establish a baseline of the individual's mental state, to identify symptoms and patterns associated with schizophrenia, and to differentiate schizophrenia from the mental disorders. And in this MSc, they check the client's appearance, mood, thought process, insight. They check, does the person look well kept or unkempt? Are they calm or agitated? In the speech, is the speech clear and understandable, or is it rambling, nonsensical, or slowed down? In thought content, they see, do they have any false beliefs, believing they are being watched or controlled by others? They will check their thought processes, whether it's logical, organized, or disorganized. Like are they jumping from one idea to another without a clear connection? Even their cognition, insight, risk are assessed through mental status examination. When to seek a professional help? It's important not to wait until the symptoms get worsened. Immediately, you have to get back to the professional. Help for schizophrenia when a person shows signs like persistent hallucinations, delusions, disorganized speech or behavior, social withdrawal, or noticeable decline in functioning that affects their daily life. And to whom to seek professional help? A psychiatrist, a clinical psychologist, or a mental health professional experienced in treating schizophrenia. And you can also find support and guidance from mental health hospitals and clinics that specialize in schizophrenia treatment. Now over to Swati ma'am.
Thank you, Rameshwari. When we are coming to the treatment for the schizophrenia, which is typically involves a combination of the medications, therapies, and lifestyle changes. Let us to go in detailed explanation. Here, the electroconvulsive therapy, which is known as the ECT. ECT, it is not a first line treatment, like a first choice of the treatment for the schizophrenia, but it is a viable option to treat the individual in a specific situations. ECT can be effective for the individuals whose symptoms do not improve with antipsychotic medicines. And the dosage are the sessions for the ECT. It is completely depend upon the individuals, the intensity of the disorder and the symptoms. Let us to go with the antipsychotic psychotic medicines, antipsychotics. These medications help to reduce the symptoms such as hallucinations, delusions, and disorganized thinking by balancing over the brain chemicals, nothing but the neurotransmitters. In this one, some of they are here mentioned, like a clozapine. It is a treatment for the resistant cases only. The others are risperidone and olanzapine, aripiprazole. And here, the duration and dosage, it is a key role in this treatment. The medications are usually started at a low dose and gradually increased to find the optimal balance between the efficacy and the side effects. And we have to keep in our mind, like all these has to be prescribed and monitored by a psychiatrist. Let us to go with the other therapies, like where we are going with the cognitive behavioral therapy, psychoeducation to the schizophrenia individual and family interventions and family counseling, social skills training, and stress-fit well-being toolkit, where the certified and trained psychologists, they can taught like a 30 MRI techniques. It is happening and going through in the sector of Manojagrithi, Sudisha. Let me explain the cognitive therapy. Cognitive behavioral therapy, the main target, it is to such as get the attention and the memory problems to balance the thought process. And psychoeducation, which is very important to the individuals who is going through the schizophrenia, not only to him, even for the family members even. Let us to go with the things that family members and the caregivers can do to help the patient. Firstly, we have to learn about the schizophrenia. Schizophrenia, to understand that having this illness is neither the person's nor the family's fault. And don't pressurize and criticize the individual or the family. Do have a conversation and listen to the person about his or her experiences. Know what the person's symptoms are, how to get help if he or she get worse or new symptoms occur. Do not argue about the delusions. Focus on the reality-based topics such as current events and day-to-day things and all with them. We have to provide the help a simple daily routine with a few changes. We should not give the like a routine daily chart. We should not give the frequent changes because they should get the confused and it will mislead them. Behave naturally and with respect towards the person with the schizophrenia. Join a support group for the family members of people with schizophrenia. As a caregivers, it is very challenging role to attending an individual with a schizophrenia. It requires a lot of patience, empathy, understanding towards the schizophrenic individual. So it's a quite natural for the caregivers to burn out and feel exhausted. Let us to focus on some survival tips. Plan ahead. The caregiver should plan a proper plan to treat or going through the schizophrenic individual. Take one day at a time. Should not rush to the schedule how he or she is going through the individual. Accept help whenever the help he or she needed. Accept the help and get the help from the others. Get enough rest and eat properly. Be good to yourself. Learn about available resources. Always we have to, the caregivers has to go through the update that what are the real resources are available and we have to use that one. Develop contingency plans. Means like they have to plan for the future, the possible future events. Make your health is a priority. As a caregiver, you're taking care of the individual of the schizophrenia, but still, it is really very important to take care of your own health. Make time for the leisure, take a break, share your feelings with the others. Let me go through a case study. Here, he is a great mathematician, an awardee of the Nobel Prize, John Nash. He has received the Nobel Prize in economics. His father, John Forbes Nash, he's an electrical engineer, and his mother, Virginia Nash, is a school teacher. And he made a fundamental contributions in the mathematical field, especially in the game theory and real algebraic geometry. The Nash didn't publish much publications because of his mental illness, but still, he had anticipated many concepts of the modern cryptography. At the age of 30, John Nash has suffered his first bout of full-blown schizophrenia. His wife, Alki Nash, when he has went through this disorder, that time she always wanted to help him. Although Nash's mental illness, the first began to manifest in the form of paranoia. His wife later described his behavior as erratic. Nash always thought that all men who wore a red tie were a part of the communist conspiracy against him, and he always mailed letters to the embassies in the Washington, D.C., declaring that they were establishing a government. He also used to claim that aliens had been sending him coded messages, and he started to isolate. While isolating, he did a much work on decoding of that coded messages, which he was claiming that those are sending from aliens. In a combination of all these symptoms led to a diagnosis of schizophrenia. He was treated with the antipsychotic medication. John Nash began to gradually recover and he stopped taking medicines completely after 12 years of medication and other therapies. Yes, he was never again committed to a hospital. Most people will believing that schizophrenia faced inevitable and decline with no possibility of recovery. But when we are going to know about the NASH, it is we can we have to change our perceptions. Nash returned to the academic work and later received the Nobel Prize in Economics in 1994. Hope now the audience and other public they have to change their perception about the schizophrenia and shift their idea about it. A Beautiful Mind, which is an award-winning film based on John Nash biography. If time permits, kindly watch that movie. To, to deal the schizophrenia furthermore, let us to go through a role play. Hello, Jyoti.
Hello, ma'am. Good evening.
Good evening.
Swati,
Jyoti.
stop. Swati,
Okay.
stop the slides.
Okay.
I'll put you in. I'll spotlight. Stop.
Yeah, ma'am.
Stop the roll. Just be there. Yes.
Hello, Jyoti.
Hello, ma'am. Good evening.
Good evening, Jyoti. What make you to come over here?
Ma'am, I have brought my daughter here. She's been acting weirdly nowadays, and I'm really worried about her and her health. We don't know what to do, and I brought her here.
Okay, I can see her. What kind of the other observations you have make in her?
She seems to be sitting alone in her room, not moving from one place. And she's talking to herself lately. She's also claiming that someone is watching her, spying on her all the time. She's not eating food, also thinking that we might poison her. So a different emotion she is expressing. Sometimes she is laughing, giggling, and sometimes she's very angry within seconds. We don't know what is happening with her. I'm really worried, ma'am.
I can see. Okay. Jyoti, since how long she is doing all this kind?
It's been 7 to 8 months, ma'am.
7 to 8 months. In this whole period, how you cope up with her symptoms and with her behavior?
We try to calmly approach her, but no matter our approach, she behaves radical. And we discussed it in the family. Some of our relatives suggested a temple to visit, thinking that it is a demonic possession. And we took her there. We saw some person, a leader in the temple. He gave some religious things to work. We took her to the temple 2 to 3 times in these 7 to 8 months, but there is no improvement, ma'am.
You consult any psychologist or psychiatrist?
No, ma'am, we never visited any psychiatrist.
What make you to stop, Jyoti?
We were not sure if it is a medical condition, thinking that we all genuinely thought it might be some demonic possession as suggested by our relatives. So we did not thought of going to a psychiatrist. Medical help we did not seek.
While describing all the symptoms of your daughter, we have to go further more uh, to prescribe about that what kind of the medical disorder she is facing. But actually, all the symptoms, whatever you have told me that what exactly and how she is behaving and all, which is comes under to the psychotic disorders like a schizophrenia. And while these religious leaders, they can perform their own perception and all, but actually to seek the moral help it can work, but to seek the medical help it is only the way to seek from the certified and the trained psychologist, psychiatrist. It is very important. Schizophrenia, it is a mental health disorder which can be manageable while if you are following all the treatment methods without failing. Psychologists play a crucial role in treating schizophrenia, and while he will use the cognitive behavioral therapy and they can give you the actual psychoeducation, which are very essential components to support and manage their condition.
Okay, ma'am.
I hope today all the audience can get how to deal and what should not do in the schizophrenia.
Yeah, I'm here. Are we near the Q&A? Swati?
Yes, ma'am. Yeah, ma'am.
Are we near
Some of the questions, yeah, ma'am. Can I go through the questions, ma'am, from the
Yes,
audience?
I'm available. Yes, please. Yes, please.
Bhargavi has asked that precautions to not getting schizophrenia, what can be the everyday mandatory routine?
To prevent?
Prevent.
No. See, if you understand schizophrenia, sometimes there is no reason also. And so it is not like prevention of schizophrenia, but I would call it as well-being routine. So if you are into a well-being routine, in the sense, if you are taking care of your lifestyle, your food, your relaxation, or managing your stress, being productive, all these things can make a difference in your future well-being. But there is nothing like you can prevent schizophrenia. No.
And one more question. Anuradha Garu, she was asking that CT scan and MRI are mandatory.
See, this medical doctors can decide. If they suggest you should do everything, whatever they suggest, please do it. See, when you go to doctor, that is psychiatrist, in this sort of disorders, it can be bipolar, schizophrenia, psychosis. So you need to follow the directions of doctor, because we don't know, we are not medical people. So, and I am also not a medical person. So I'm not a right person to answer this question. But only one thing I can suggest is, when you go to doctor, follow him. But find a good doctor. You just don't blindly go to some hospital and then try to, think about all this. First, find a good doctor whom you can trust. Then follow them with trust. That's what I can suggest.
One more question, ma'am. The question
Yes.
was, the first is psychologist and then go ahead with the medical or psychiatric help. This should be the stages in the addressing schizophrenic patients. To what level we can help this?
I'll tell you. When you see the symptoms of schizophrenia, the protocol would be, first, definitely you should go for assessment. You should do a psychometry. Before even that, you should go to psychiatrist for medication, because immediately once you start medication, you will see the improvement in the symptoms. So then assessment is very important. Then after that, you will go for psychotherapy or you will go to a psychologist like us. But medicine and therapy both are important. For schizophrenia, both are very, very important. I have personal experience where using medication for years together, but just living with the symptoms. And with medication along with therapy, there was a great improvement. So try to visit a psychologist, visit a psychiatrist, both mandatory.
Next question, ma'am. When the mother got schizophrenia at 42 years, what can be the possibility of getting the diseases to her children?
What is the possibility of for the children?
Yes, ma'am.
So yeah, there is a genetic possibility. So sometimes it runs. So but it is not కంపల్సరీ ఆర్ ఓ హోతా హే ఐసా తో నహీ హై ఖచ్చితంగా వస్తుంది అనేది లేదండి కానీ పాసిబిలిటీస్ ఉంటాయి.
One more question, ma'am. Medication has to be done lifelong for the psychological problem?
Generally for schizophrenia, generally medicine would be very long. See, I'll give you one example here because many people ask this question in webinars to me. See, they ask like lifelong I should use this medicine. Yeah, I agree. It is very tough. You look at it as a tough thing. But let me ask you a question. How many of us in this webinar are using medication for BP, medication for diabetes for lifelong? I am using a BP tablet since maybe 18 years now. And I'll be using for lifetime. What is wrong in it? Why not a psychiatric medicine? Every medicine has a side effect, but when it is helping you, nothing wrong in using. So generally, the way we look at the psychiatric medicine is different from the way we look at the normal medicine. So for many things we use medication, no, continuously for lifelong we use. And some children sometimes children who are diabetic, when they are kid, they start medication for diabetes and they use it for lifelong. Thyroid, BP, whatnot. So it's okay. When it is helping, just look at it as a very, very helping aspect. Do not try to resist for medication.
Next question, ma'am. How the family members cope up in dealing with schizophrenia people, ma'am?
As I think your slides already covered, we discussed that in the PowerPoint, but still I would say the caretakers will become patients over a period of time. So better you take care of yourself, allow some time for yourself, give yourself me time, and charge yourself all the time, and take breaks from the patient or from the client or from the person who is going through. So share the responsibility of the person, and you are responsible and you care for them, you definitely love them, but doesn't mean that your life is in threat. So when I give an example, when in the flight, initially when takeoff is happening, they say first you have your oxygen mask, then put a mask for another. Help others to take the mask, oxygen mask. Similarly, helping in the process of helping a client or a patient, don't become patients. Take care of yourself. That is very important. And research is also showing that caretakers burnout is very common. Yeah.
Severe mental disorders to some extent are genetic.
Yes.
And another question, ma'am. Severe PMS symptoms leads to the schizophrenia?
No. There is no connection. Absolutely no connection. That is different. This is different. PMS generally have comorbidity of depression, anxiety, but not schizophrenia. Yeah, good to go.
Yes, ma'am.
Congratulations, all of you, 3 of you.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
I would
And
like to thank you, Geetha ma'am and Vijay Lakshmi ma'am.
this is
Madam,
again a very proud moment and very happy moment to see my students presenting toughest subject, toughest topic. Generally, people need courage to talk about these disorders, but
yes,
we took it as a
yes, madam.
challenge, and all my Sahaya diploma students are doing it. Every day, a new disorder is presented, and many people are calling me, messaging me, telling that we are really, really getting that awareness about psychopathology or psychological disorders. Congratulations to all of you, and 3 of you specifically for today's webinar. Yeah, thank you for
Thank you,
all the
ma'am.
participants who are here today. Very, very, very lively sessions going on.
Thank you, ma'am.
Thank
Over
you,
to
ma'am.
you, people. Right.
Thank you, madam.
Someone is asking for YouTube.
Madam,
So yes,
namaste,
definitely
madam.
these are there in the YouTube only. It will be good if we get yeah, this is going live in the YouTube immediately after session. 1 hour it takes us to convert or send you the link. So just give us 1 hour time. You will get the proper link of YouTube. All these webinars are posted in our YouTube channel. Yeah, someone was asking questions. Sorry. You can stop sharing.
Madam, namaste. నేను రామలక్ష్మి. I
చెప్పండి, ma'am.
heard of a schizophrenia patient అంటే వాళ్ళు కొంచెం కంట్రోల్లో ఉండరు, అవి ఇవి విసిరేస్తూ ఉంటారు. అట్లా అంటే వాళ్ళ దగ్గర వెళ్ళటానికి కూడా కొన్నిసార్లు వాళ్ళు గబుక్కున ఆ టేబుల్ మీద కత్తి ఉందనుకోండి, అది పెట్టి అంటే బికాస్ దే ఆర్ పేషెంట్, దే డోంట్ నో కదా, కొంచెం వాళ్ళని హ్యాండిల్ చేసుకోవడంలో రిస్క్స్ ఉంటాయి కదా, మరి దాన్ని ఎట్లా ఓవర్కమ్ చేస్తారు?
So let me tell you one thing. Schizophrenia-లో అంత వైలెంట్ బిహేవియర్ ఉండదు. మీరు చెప్తున్నది సైకోసిస్ లో ఉంటది. Schizophrenia-లో
Okay.
వాళ్ళకి అంత వైలెంట్ బిహేవియర్ ఉండదు. There is a different problem called psychosis. సో సైకోసిస్
Okay.
లో కొంచెం అలాంటివి సెల్ఫ్ హార్మ్ ఆర్ హార్మింగ్ అదర్స్ ఉంటుంది. అక్కడ మీరు చాలా ఎక్కువ కేర్ఫుల్ గా ఉండాలి. బట్ స్కిజోఫ్రెనియాలో యు నీడ్ నాట్. అయితే పాథటిక్ థింగ్ ఏంటంటే the pathetic thing or very bad what is happening in the society is actual disorder idi ani cheppatledu. So the people are confused now, and they are living with the problem for 10-15 years, but the family don't know what is the problem, and they are on medication. They visit the consultant, but they don't know what is the disorder. So now that is why we are conducting these webinars to
Bring
create
awareness
on
Yes, madam.
each disorder, so that you know this is schizophrenia, this is bipolar, this is depression.
Yeah,
And this is
differentiate చేయగలగాలి.
yes. Okay.
Yes, madam. Thank you very much.
Thank you. Over to you, my dear students. You can conclude the webinar and go ahead.
Thank you, ma'am. Before closing today's session, let me go with a few words on Sudisha. Sudisha is a counseling center which is located at Kondapur, and here we have provided the contact and email, and which is providing the services on counseling, assessment, and different therapies, which is in a different wings like a Vriddhi, where you can see the cognitive stimulation program for the children 0 to 6 years, where 250 brain stimulation activities will be there. Their language development, physical and motor development, social and emotional development, and multi-sensory development will deal. In the wing of the Spurti, 40 hours of positive parent course will deal. And under the Sanjeevani, it can deal with the skill and value-based program for the children, where you can go with the social skills, self-help skills, smart study skills, and values for the life. And the Naipunya, they can taught you the 10 lakhs for skills training program. And we are having the counseling services like individual counseling, adolescent, child, family and marriage counseling, special education counseling and grief counseling, stress management, career counseling and all. And it is good to know that the counseling can be online or the telecall. Once again, thank you one and all.
Thank you all.